What is photoparoxysmal response, PPR, in epilepsy? Imagine your brain as a busy city with electrical signals flowing like traffic. Sometimes, flashing lights or bright patterns can cause a traffic jam, leading to abnormal activity. That's what happens in a photoparoxysmal response, or PPR, in epilepsy. It's an abnormal brain reaction seen on an electroencephalogram, which is a test that records electrical activity in the brain. During this test, when flashing lights or visual stimuli are used, some people's brains show spikes or spike and wave patterns. These are signs of heightened sensitivity to visual triggers. PPR isn't a seizure itself but a marker that shows the brain reacts strongly to certain visual stimuli. It's most common in people with photosensitive epilepsy, a type of epilepsy where flashing or flickering lights can trigger seizures. The response can happen when the brain is exposed to flashing lights, bold geometric patterns, or moving images. When doctors perform an EEG with intermittent photic stimulation, or IPS, they look for PPR to help diagnose photosensitive epilepsy and understand seizure risk related to light. The characteristics of PPR can vary. Sometimes it involves generalized discharges across the brain, and other times it's focal, meaning localized to one area. The waveforms seen can differ from person to person. PPR is more often seen in children and young adults and can be more common in certain epilepsy syndromes like juvenile myoclonic epilepsy and Jeevan's syndrome. Interestingly, PPR may lessen with age and can be affected by factors like sleep deprivation, which can make the brain more excitable. Knowing about PPR is helpful because it highlights who might be sensitive to light triggers that could cause seizures. For people with PPR, avoiding flashing lights, strobe effects, or bright screens can be an important part of managing their condition. Doctors might also recommend medications that help reduce light sensitivity, such as sodium valproate. It's important to remember that not everyone with PPR on an EEG will have seizures triggered by light in daily life, but it's a useful tool for understanding individual risks. In essence, PPR is a sign of increased brain excitability in response to visual stimuli. It helps doctors diagnose and manage photosensitive epilepsy by identifying those who are more likely to have seizures triggered by light. If you or someone you know has PPR, working closely with a healthcare professional can help develop strategies to minimize triggers and keep daily life safe and enjoyable. Always consult a medical expert for personalized advice, as individual experiences with light sensitivity can vary greatly.